fair enough. And I have some other interesting question, but this one is intriguing. And without naming who is asked, is it really possible, and maybe it's a myth or fact, is it possible for a person to get COVID even after the 2 doses of the vaccine?
Yes, absolutely. So you may get COVID. If you do, you will not get the severe form of the disease. You will stay away from the hospital, stay from the ICU, stay away from death. But some of the vaccines, especially the AstraZeneca, is not very, very efficacious against preventing infection against some of the mutant strains. That becomes consequential because even if you have taken the vaccine, both doses, you might be infectious and therefore you might be transmitting the virus to a person around you who has not taken the vaccine. So the point I'm trying to make is, even after you've taken the vaccines, it's not a time that you think that everyone around you is protected. It's still necessary for you to mask, distance as much as you can, hand wash, proper cough etiquette, and so on. It protects you, but you are still prone to infection, and by that measure, prone to transmitting the infection to people around you who have not been vaccinated yet.
So you've answered to a couple of questions that people have asked. One is, does vaccination prevent the carrier status? Answer is no. You could still be a carrier. And to the earlier question, you have mentioned that yes, it is possible to get COVID even after 2 of your doses. And you also answered Naveen Sharma's question that whether you need to wear a mask and follow all the simple measures post vaccination. You must do it. It is very important. I mean, there are lots of other questions, and there are some very specific ones. So I'm sorry, I'm not going to ask them. It's around contraindications. It's around if I have so and so, or my so and so is so many years old. The messaging which I hear is, in case you have a medical issue, if there's a comorbidity, the best thing to do is please speak with your doctor. I don't think we should be giving any medical advice on this show currently. One interesting question, and again, I think it's more about if there are 2 doses and if there's a 4-week period between the dose, and you mentioned that it could be prolonged. What if somebody has to travel in that period? Say I've taken a dose overseas and it is AstraZeneca, but I need to come back to India. Can I complete my 2nd dose and take the Covishield here?
That's a difficult one to answer. I wouldn't know what the government stand on that is, but if you've actually taken 1 dose, that alone should be good enough to protect you and give you some amount of, and if you've taken the same vaccine abroad, and if it's the AstraZeneca vaccine that you've taken abroad, I think it should be okay to take the same vaccine, but whether you're going to be allowed or not, I don't know what the government policies on that are.